Hi, everybody. My name is Dr. Christiane Northrup, and I want to answer some commonly asked questions about Pueraria mirifica and Amata life. So let's start. Here's one. I'm currently using Soto pellet therapy for my hormone replacement, which includes injected pellets of estradiol and testosterone to balance my hormones. That's perfectly logical, and if that's working for you, you can just continue that. And many women ask if they're already on some kind of hormone therapy, whether they can add the Pueraria mirifica. You can, but many times you don't need to. It really all depends on how your current regimen is working for you. So if you're loving it and everything's going along well, don't change. However, the Pueraria mirifica that we have at Amata Life gives you an option to have something that's non-prescription. Remember that the two things work in different ways. So the bioidentical hormones like the testosterone and 17-beta estradiol land on the alpha estrogen receptor, and that's a growth hormone in breasts, uterus, everywhere there are estrogen receptors, which is all over the body, including the brain. The Amata Life Pueraria mirifica interacts with the beta estrogen receptor. So it's different. It's like a SERM, a selective estrogen receptor modulator. So they work in two different ways. And generally speaking, you can use one or the other, but you don't necessarily need both. However, many women want to switch to the Amata from the current regimen that they're on. How do you do this? You begin by taking the Amata Life at the usual dose, which is either one capsule in the morning, one at night, or one dose of the liquid in the morning and the night. And you do that for a solid month, while at the same time, you begin to withdraw or lower your dose of the bioidentical hormones. So let's say that you're wearing a patch, the Vivel dot or the Climera patch. So instead of changing the patch, let's say every 3.5 days, then you leave it on every 4 to 5 days. It's just a gradual decrease in your bioidenticals. But that 1 month of the Amata Life gets the Pueraria mirifica on board so that your body is not going to feel a big withdrawal. So remember, it's this way. You're decreasing one, you're increasing the other. And after about a month, they cross, and then you can just continue, let's say, on your Amata Life. But I don't mean to suggest that everyone needs to switch to Pueraria mirifica. You don't, if you're doing well with your current regimen.